Hello, I'm Dr. Mark Collins from Priory Hospitals. Addiction is hard to define precisely, but is what you would describe as anyone who is either using a chemical, alcohol or pills or drugs, or behaving in a particular way that is recurrent, excessive, causing harm, and nevertheless continues despite evidence of that. There are different types of addiction. You can define it obviously by what substance or behaviour is being used addictively, bearing in mind that people often have cross addictions. You can be addicted to alcohol and tranquilizers and have behavioural addictions as well, and you can switch from one to another. Most people who've got into trouble with something in an addictive sense do actually know somewhere inside themselves that they've got a problem. However, denial tends to block that out. Specifically with alcohol, if you consistently, more than once a month, drink 8 units of alcohol in a session or more, then you may have a problem. If you have been confronted by someone close to you, loved one, workplace, about a chemical or alcohol problem, then probably you have got a problem. If you have known in yourself that you need to stop but haven't managed, or if there have been consequences of using, drinking, that led to you not doing what you should have done, showing up at work and so on, then you probably have a problem. Knowing when to get help for an addiction is obviously subjective. If there is any evidence of medical problems, social problems, work-related problems, then probably you need to get help, at least talk to somebody. First port of call always would be general practitioner. At Priory Hospitals we have a therapist always available to do a free and confidential assessment as to whether there is a problem, and if there is, what might be the best ways forward. Anyone can suffer from addiction. There's an incidence in the general population of some sort of problem approaching 10%, and within that 10%, 10% will have a very serious problem. If you have a family history of it, if a parent or close relative suffers from an addiction, then you are statistically significantly more likely yourself to have one. Treatment options for addiction obviously depend, first of all, how far along the pathway of addiction you've gone. The first instance, recognition that there is a problem is the best thing you can do. Talking to somebody is the next best thing you can do. You can talk to your general practitioner, you can talk to a therapist. For example, at Priory Hospitals, you can have a confidential free assessment with a therapist just to talk through whether or not you've got a problem. The range of treatment options then might be individual counselling, self-help groups, Alcoholics Anonymous, Narcotics Anonymous, etc., ranging from that through to more intensive treatment options such as, finally, residential treatment. We recommend abstinence in people who've crossed a certain line of addiction, and that can be difficult to achieve, hence the need for an intensive program. We offer a 4-week residential program for abstinence-based treatment, and for a year we offer weekly free follow-up to reinforce what was learned in the program. Addiction is a very tenacious disease, and despite all logic that abstinence is sensible, people are very vulnerable to relapse in their first year. The length of treatment obviously to an extent depends on how far the problem has got. Counselling may last for easily a year, sometimes longer, on perhaps a weekly basis. For those people with a more severe problem, residential treatment lasts for 4 weeks typically, occasionally a bit longer, and critically, aftercare following a period of residential treatment lasts for at least a year. Priory Hospitals make a point of offering free weekly aftercare for that reason. Some people may need more input attending workshops, and having other forms of psychological therapies if other problems emerge. If somebody's motivated to get help, the chances are actually much higher than people may think. For someone who's completed a residential treatment program of 4 weeks, if you look at outcome at a year, well over 2/3 are doing well. For people struggling with addiction, my advice would be please get help. Overcome pride, overcome denial, ask for help. In the first instance, your GP should be able to help. You can always ring someone at Priory Hospitals for a confidential chat with a therapist.